How to survive a heart attack alone after 60. 7 life-saving tips every senior must know. It's a chilling prospect, one that many of us, especially as we age and perhaps live alone, have considered. What would you do if a heart attack struck and you were completely by yourself? This scenario, while frightening, is a reality more often than we might like to think. The common misconception is that we'll have ample time, or that someone will inevitably be there to provide aid. However, the stark truth is that the initial minutes following the onset of a heart attack are the most critical. Your immediate actions or inactions can profoundly influence the outcome. The encouraging news, however, is that even if you reside alone or spend a significant portion of your time in solitude, survival is absolutely attainable if you can act swiftly and with purpose. This guide is designed to equip you with precisely that knowledge, walking you through 7 essential actions to take the very moment a heart attack begins and you find yourself the only one around. These steps are straightforward, practical, and most importantly, life-saving. They do not necessitate specialized medical training or sophisticated equipment. All that is required is preparedness and the ability to remain calm. We will meticulously break down each stage, from identifying the earliest warning signals and knowing what to ingest immediately, to understanding how to reduce your heart's workload and even employing small, deliberate actions that can grant you precious moments to receive the assistance you desperately need. Please stay with us until the very end, as the final steps are frequently overlooked, yet they may very well be the very ones that ultimately preserve your life. It's imperative not to postpone learning what your body is attempting to communicate until it's tragically too late. Let us commence this vital journey of preparedness. 1. Recognizing the earliest warning signs. The foundational and paramount step in navigating a heart attack when you are alone is to possess an acute understanding of its manifestation, not solely in your chest, but throughout your entire body. The prevalent public perception often paints a picture of a dramatic, crushing chest pain, akin to cinematic portrayals. However, the reality is that genuine heart attacks frequently commence with far more subtle symptoms. These initial signs can be deceptively easy to dismiss, leading to a dangerous delay in seeking help. What you should be vigilant for is a deep, uncomfortably intense pressure or a constricting sensation in the very center of your chest. It might feel as though a heavy weight is pressing down on you, or as if your chest is gradually being filled with a dense, unyielding substance. This discomfort could also be intermittent, ebbed and flowed, leading you to rationalize it as something minor and inconsequential. Nevertheless, if this sensation persists for more than a few minutes or recurs repeatedly, do not hesitate to take it seriously. Beyond chest discomfort, other nascent indicators include shortness of breath, even in the absence of any chest pain. You might experience the sensation of having just exerted yourself strenuously, such as climbing a steep incline, even while remaining perfectly still. Some individuals report experiencing pain radiating to their arm, shoulder, neck, or jaw. Others may feel lightheaded, break out in a sudden cold sweat, or experience nausea and dizziness. It's particularly noteworthy that in certain demographics, especially among older adults or women, the perceived pain might manifest more as generalized pressure in the back or abdomen rather than a distinct chest sensation. Consider the illustrative case of Richard, a 74-year-old gentleman. He was seated at his kitchen table one morning when he felt an unusual tightness just below his collarbone, a sensation he initially likened to heartburn. However, this was soon followed by an inability to take a full breath and a distinct sweating of his hands. Recalling information he had previously encountered, he knew that not all heart attacks presented with overt pain. Consequently, instead of dismissing these symptoms, he chose to act. This proactive decision likely proved to be life-saving. The human body, in its intricate wisdom, often whispers its distress before it escalates to a scream. In the context of a heart attack, these subtle whispers represent your sole opportunity to intervene before irreversible damage takes hold. If you defer action until the classic, dramatic, chest-clutching scenario unfolds, it is highly probable that you will have already passed the critical window for intervention. Therefore, the next time you experience any sensation that feels out of the ordinary, particularly if it involves a combination of chest pressure, inexplicable shortness of breath, or profound and unusual fatigue, it is imperative to cease your current activity. Resist the urge to tough it out or to convince yourself that it is merely indigestion. The ability to recognize these incipient warning signs is your initial and most critical advantage in the fight for survival. Treat them with the utmost seriousness, even if their intensity seems minimal. Your very life could hinge upon this awareness. 2. Calling emergency services immediately. The instant you harbor even the slightest suspicion that a heart attack might be initiating, the absolute next course of action, executed without a moment's hesitation, must be to dial emergency services. In most regions, this means calling 911. Do not fall into the trap of waiting to see if the symptoms spontaneously resolve. Do not attempt to navigate the journey to a hospital by yourself. And critically, do not rationalize the situation by convincing yourself that you are overreacting. Initiating contact with emergency medical services is not merely the swiftest route to receiving professional assistance. It is demonstrably the most effective measure you can take to ensure your survival. A heart attack is not a condition that can be simply walked off. Every single minute that elapses is of profound consequence. The longer your heart muscle is deprived of vital oxygen, the more extensive and potentially permanent the damage will be. However, when you make that critical 911 call, highly trained professionals are already mobilizing, preparing for your specific situation as they en route to your location. They are equipped with specialized tools, life-saving medications, and the critical capacity to sustain you even if your heart stops beating on the journey to the hospital. Furthermore, and this is a crucial point, if your symptoms escalate rapidly, as they often do, you will quickly find yourself unable to assist yourself. This is precisely why attempting to drive yourself is one of the most perilous decisions an individual in this predicament can make. You risk losing consciousness at the wheel, potentially causing a devastating accident, or, more critically, significantly delaying your own essential medical care. It is far safer and more effective to allow the trained professionals to come to you. Reflect on the experience of Linda, a 78-year-old woman. She experienced a peculiar ache in her left shoulder, which was subsequently followed by an overwhelming wave of nausea and a chilling cold sweat. Her initial inclination was to call her son. However, she then recalled a piece of advice from a nurse she had encountered previously. If you are alone and suspect you might be having a heart attack, call 911 first. You can speak to your family later. She heeded this wisdom and placed the call. By the time the ambulance crew arrived, her symptoms had significantly intensified, but the medical team was fully prepared. They were able to stabilize her on the spot, a direct consequence of that timely phone call. It is vital to understand that you do not need absolute certainty that you are experiencing a heart attack to summon help. The emergency dispatcher will not be inconvenienced, nor will they be upset if it is ultimately determined that your symptoms were due to a less severe cause. In fact, their preference is unequivocally to dispatch resources unnecessarily rather than to miss a critical opportunity to save a life. Therefore, it is paramount to maintain your mobile phone in a location where it is readily accessible at all times, especially if you live alone. Should you begin to experience symptoms that impair your ability to speak clearly, utilize the emergency call feature available on most devices. Many modern smartphones are equipped with a shortcut to initiate an emergency call, even when the device is locked. Take the time to familiarize yourself with its location and know how to activate it swiftly. If you are still engaged with this video and finding the information presented to be of significant value, please consider leaving a comment with the number 2 below. This serves as an indicator that you are actively following along. Moreover, if you have not yet subscribed to our channel, we highly recommend doing so and activating the notification bell. This ensures you will not miss any future important videos. Your support is instrumental in enabling us to continue producing high-quality content designed to inform and inspire you. Now, let us proceed to the subsequent critical step. 3. Chewing an aspirin slowly and calmly. Following the crucial act of contacting emergency services, the subsequent most potent and accessible action you can undertake is remarkably simple. Chew an aspirin. It is imperative to emphasize, chew, do not swallow. And perform this action slowly and deliberately, even if your hands are trembling with anxiety. If you have a standard 325 milligram aspirin readily available, and you are not afflicted by an allergy to aspirin or are not currently taking anticoagulant medication that would contraindicate its use, this single step can dramatically enhance your prospects of surviving a heart attack. Aspirin functions by thinning the blood. This action helps to impede or prevent the further development of a blood clot that is likely obstructing one of your coronary arteries, the very blockage that is instigating the heart attack. By chewing the tablet rather than swallowing it whole, you expedite its absorption into your bloodstream. Scientific studies have demonstrated that this method can effectively buy you invaluable minutes, sometimes even sufficient time to partially restore blood flow to the heart muscle before medical assistance arrives. It is generally advisable not to take aspirin on an entirely empty stomach unless absolutely necessary. However, in the dire circumstance of a suspected heart attack, the immediate and life-threatening risk posed by a blood clot far outweighs any potential gastrointestinal discomfort. Furthermore, it is important to avoid taking coated or delayed-release aspirin formulations. If these are the only types available, chew them nonetheless, as your primary objective is to initiate the aspirin's effects as rapidly as possible. Let us consider the case of Joe, a 72-year-old gentleman. One morning, he experienced a spreading tightness that originated in his chest and extended to his neck. He remembered that he kept a bottle of aspirin in his kitchen cabinet. He promptly chewed one tablet while remaining seated and awaiting the arrival of the paramedics. Later, his cardiologist informed him that this singular action had likely mitigated the extent of the damage to his heart muscle. The physician attributed the favorable outcome to that small pill, stating that it had prevented the situation from deteriorating further. If you live alone, it is of utmost importance to ensure that aspirin is easily accessible. Consider storing some tablets in your nightstand, your kitchen drawers, or even carrying a small supply in your wallet. Always verify that the aspirin has not passed its expiration date. Additionally, it is advisable to inform a trusted loved one or a close neighbor about the location of your aspirin supply should they ever need to assist you in an emergency. This seemingly minor act, while simple in its execution, is firmly grounded in scientific evidence and is a standard practice employed by emergency medical responders worldwide. The act of chewing aspirin during the initial stages of a heart attack is not merely a suggestion. It is a proven and effective intervention. In those critical first few minutes, it has the potential to be the decisive factor between recovering and walking out of the hospital, or sadly, never making it there at all. 4. Sitting or lying down to protect your heart. Once you have successfully made the critical call for emergency help and administered aspirin, your next directive is equally simple, yet absolutely vital for your well-being. Cease all unnecessary movement. Assume a seated or lying position that feels as safe and comfortable as possible. This is not the time for pacing the room, gathering your personal belongings, or attempting to unlock doors unless it is an absolute necessity. Any additional physical exertion places an undue and dangerous strain on your heart, which is already desperately struggling to procure sufficient oxygen. Ideally, you should position yourself sitting upright with your back well supported, your feet flat on the floor, and your arms resting loosely by your sides. This posture helps to minimize your heart's workload while you await the arrival of paramedics. If you experience feelings of faintness or dizziness, it is best to lie down on your side with your head slightly elevated. It is crucial not to attempt to power through the discomfort or pain. While such a mindset may have served you well in other aspects of your life, in this specific moment, it represents a risk that you simply cannot afford to take. It is a common human reaction for individuals to feel a sense of embarrassment or apprehension about calling for emergency assistance and then subsequently remaining relatively still. However, make no mistake, by choosing stillness, you are actively doing something beneficial. You are affording your heart an opportunity to stabilize. You are encouraging slower, more regulated breathing, and you are preventing your body from expending its already limited oxygen reserves. Consider the experience of Alice, an 81-year-old woman. When she began to feel a radiating pressure across her chest, her immediate impulse was to tidy her kitchen and compose herself. However, she remembered a crucial piece of advice from her doctor. If you think it's your heart, sit down. Everything else can wait. She promptly sank into her favorite recliner and awaited the arrival of help. She later learned that this period of stillness likely prevented her symptoms from escalating into a full-blown cardiac arrest. Therefore, if you ever experience the creeping onset of these symptoms, chest pressure, shortness of breath, dizziness, do not attempt to complete your current task. Stop precisely where you are, or move as minimally as possible to a safer, more stable location. Sit or lie down, remain still, breathe slowly and deliberately, and allow your body to dedicate its entire focus to the singular critical objective: survival. Here is a simple, yet often overlooked detail. If you are seated in a chair that lacks armrests, avoid allowing your body to slump. Maintain an upright posture with your spine supported and your chest open to facilitate unobstructed breathing. The more relaxed and upright your physical position, the less effort your heart is required to expend. If you are still actively watching this video and finding the insights provided to be of significant value, please take a moment to comment with the number 4 below. This action lets us know that you are engaged with the content. Additionally, if you have not yet subscribed to our channel, we strongly encourage you to do so and to activate the notification bell. This ensures you will be alerted to all our future videos. Your continued support is essential in allowing us to produce valuable content that informs and inspires our audience. Now, let us advance to the next important step. 5. Unlocking your door for emergency responders. If you find that you still possess sufficient strength after having called for emergency assistance and settled into a resting position, one of the most profoundly helpful actions you can take is to unlock your front door. This may appear to be a minor, inconsequential task, but in the context of a medical emergency, even mere seconds can make a critical difference, and a locked door can introduce a significant delay in the initiation of treatment when time is of the absolute essence. Emergency medical technicians are, of course, trained to gain entry forcefully if necessary. However, such forced entry invariably consumes precious time, can result in property damage, and might even startle or inadvertently injure you if you happen to be in close proximity to the point of entry. By proactively unlocking your door in advance, you enable the responders to enter unimpeded and commence their vital care immediately. This seemingly small act has the potential to save several crucial minutes that your struggling heart may simply not have to spare. If you reside alone, particularly in an apartment building or a gated community, it is prudent to contemplate the logistical implications of this step well before a crisis ever arises. Is your door readily operable from the inside? Is your address clearly visible and easily identifiable? Is there a spare key accessible to a trusted neighbor or a nearby friend or family member? These are considerations that might not seem urgent in the course of daily life, but they can become critically important in a moment of acute need. Consider the situation of Paul, a 76-year-old man living in a small condominium. When his symptoms began to manifest, he swiftly called 911, chewed an aspirin, and proceeded to unlock his front door, all within a remarkable span of under 2 minutes. The paramedics subsequently commented that this single, decisive action enabled them to reach him approximately 30 seconds faster and also spared them the necessity of a forced entry. Paul later reflected, stating, "That was the last thing I would have thought of, but it might have been what got me the help I needed just in time." If the physical act of walking to the door feels too risky or strenuous, do not attempt it. Remain seated and concentrate on regulating your breathing. However, if you are situated relatively close to the door and feel stable enough to reach it safely, then proceed to unlock it. It might also be advantageous to investigate the possibility of installing a smart lock that offers remote access capabilities, or to utilize a medical lockbox designed to securely store your key. This is especially beneficial if you live alone or have any mobility challenges. It is a modest measure of preparedness, but it sends a clear and reassuring message to the individuals who are coming to your aid. You are ready, you have fulfilled your part in facilitating their efforts, and now it is their turn to perform the critical tasks of saving your life. 6. Using your phone's speaker or medical ID features. In the isolating experience of waiting for help during a potential heart attack, your smartphone transcends its role as a mere communication device. It transforms into your crucial lifeline. One of the most astute ways to leverage this device in such a dire situation is by switching to speakerphone functionality. This invaluable feature allows you to converse with emergency responders in a hands-free manner, thereby liberating you to concentrate on maintaining your breathing and staying as calm as possible, without the added burden of tightly gripping your phone or holding it to your ear. When you are experiencing significant distress, even the simple act of holding an object to your ear can impede your ability to breathe freely and deeply. Employing speakerphone not only reduces physical exertion, but also ensures that the dispatcher can hear you more clearly, particularly if your voice weakens significantly. Furthermore, it permits them to discern auditory cues from your surroundings, your breathing patterns, any movements you make, even the subtle inflections in your tone, which can provide vital information about your condition. Beyond speakerphone capabilities, nearly every smartphone manufactured today incorporates a feature of equal, if not greater, importance: your emergency medical ID. On Apple devices, this information is readily accessible even from the lock screen. For Android phones, a similar feature is typically available. This digital record stores critical personal health information, including your age, known allergies, current medications, and any pre-existing medical conditions. Should you become unconscious by the time paramedics arrive, this data can significantly expedite the diagnostic and treatment process, guiding their decisions about your care. Consider the case of Susan, a 79-year-old woman. She lost consciousness mere moments before emergency personnel arrived at her residence. However, because her phone had been meticulously set up with her emergency medical ID, the paramedics were immediately aware that she had diabetes and a severe allergy to penicillin. This knowledge prevented them from administering a medication that could have dangerously exacerbated her condition. Moreover, they were able to contact her daughter efficiently by utilizing the emergency contact information listed directly within her phone's profile. The process of setting up this vital information typically takes less than 5 minutes, and once established, it remains a permanent resource. It is essential to include your full name, date of birth, any significant health conditions, all medications you regularly take, any known allergies, and at least 1 or 2 emergency contacts. This is not a feature exclusively for technologically adept individuals. It is a critical safety measure for anyone who might one day require medical assistance when they are unable to communicate their needs themselves. Therefore, if you ever experience the initial signs of a heart attack, make it a priority to engage your phone's speakerphone function. This maintains your connection to crucial support and allows you to place your trust in the voice on the other end of the line. Their calm demeanor, clear instructions, and unwavering presence can make the period of waiting considerably less terrifying. And should something untoward happen before help arrives, your phone may very well continue to advocate for you when you are no longer able to speak for yourself. If you are still actively engaged with this video and finding the insights provided to be of significant value, please take a moment to comment with the number 6 below. This action lets us know that you are engaged with the content. important. Additionally, if you have not yet subscribed to our channel, we strongly encourage you to do so and to activate the notification bell. This ensures you will be alerted to all our future videos. Your continued support is essential in allowing us to produce valuable content that informs and inspires our audience. Now, let us advance to the final, yet equally important, step. 7. Slowing your breath to steady your heart. In the heart of a heart attack, it is incredibly easy for the overwhelming sensation of panic to take hold. Your chest feels constricted, your thoughts race uncontrollably, and each passing second seems to amplify in its perceived loudness. However, you still possess one final, potent tool at your disposal: your breath. And if you can utilize it effectively, it can help to calm your nervous system sufficiently to provide your heart with a better chance of maintaining a stable rhythm. Controlled breathing is not intended to cure the heart attack itself. Rather, its purpose is to prevent your body from spiraling into a state of full-blown shock while you await the arrival of medical professionals. The greater your anxiety, the more rapidly your heart may beat. Conversely, by deliberately slowing your breathing, you can gently coax that elevated heart rate back down to a more manageable level. You do not need to employ any complex or specialized breathing techniques. Simply try this. Inhale slowly and deeply through your nose for approximately 4 seconds. Hold your breath for a brief moment. Then exhale gently and steadily through your mouth for about 6 seconds. Repeat this cycle. Focus your attention solely on this simple, consistent rhythm. It provides your body with a stable anchor point, and it can help to mitigate the risk of your heart developing dangerous arrhythmias that are often triggered by acute stress. Consider the experience of Frank, an 83-year-old gentleman. When the chest pain struck him, he felt an overwhelming sense of fear, as though he were drowning. However, he recalled a straightforward breathing exercise that his doctor had taught him during a routine checkup. He diligently focused on each individual breath, consciously kept himself as still as possible, and actively worked to release the grip of panic. By the time the paramedics arrived, his heart rhythm was still somewhat unstable, but it had not progressed to full cardiac arrest. He later recounted, "I just kept telling myself, stay calm, stay alive." You can practice this type of controlled breathing at any time, when you are resting, when you are feeling anxious, even while passively watching television. The more familiar and ingrained this breathing pattern becomes, the more instinctively your body will revert to it when faced with a high-stakes situation. Your breath, while incapable of directly repairing blocked arteries, can effectively buy you precious time. It can help to ensure continued oxygen flow and support your heart in its struggle to maintain function. And in those final critical moments before professional help arrives, that additional edge can be precisely what you need. Remain still, remain alive. Final thoughts. Ultimately, the ability to survive a heart attack when you are alone is not solely a matter of chance or luck. It is a testament to diligent preparation, heightened awareness, and the capacity for calm, decisive action. The 7 steps we have outlined, while perhaps appearing simple individually, collectively form a formidable chain that can safeguard your life. It is imperative to recognize the subtle warning signs, to initiate the call for emergency assistance without delay, to take aspirin if it is safely accessible, to conserve your energy by sitting or lying down, to facilitate the unimpeded access of emergency responders, to intelligently utilize the advanced features of your smartphone, and to deliberately slow your breathing to help stabilize your heart. Each of these measures serves to grant you precious additional time. Each one empowers you with a greater degree of control over a terrifying situation, and each one powerfully communicates a vital message that even when you are physically alone, you are not utterly powerless. Heart attacks can undoubtedly feel like the most isolating and frightening of experiences. However, these actionable steps serve as a potent reminder that you are not, in fact, helpless. Not for even a single moment. You possess valuable tools. You have acquired essential knowledge, and you now have a concrete plan. Therefore, take a moment to reflect. Which of these steps resonated most strongly with you today? Was there a particular measure you had not previously considered, or one that you now perceive in a new, more significant light? Contemplate how you can integrate this newfound knowledge into your daily life, and perhaps consider sharing this vital information with someone you care about. This knowledge might not only save your own life, but could potentially save theirs as well. Thank you for joining us today. We are genuinely eager to hear from you. Please leave a comment below, sharing one specific thing you learned today and how you intend to apply it in your life moving forward. Your insights are of immense importance to us, so do not hesitate to share them. Reading your comments provides us with significant motivation and encouragement. If you found this video informative and beneficial, we kindly request that you like, subscribe, and share it with your network. Your support is instrumental in enabling us to continue creating valuable content designed to inform and inspire you. Thank you for watching, and we eagerly anticipate seeing you in our next video.